Hey, before we dive into the 5 bedroom mistakes quietly affecting older men, let's take a moment to understand why this matters so much. You see, intimacy and bedroom confidence aren't just about performance or function. They go way deeper, touching your overall health, your relationships, and even how you feel about yourself every single day. For many men over 50, things don't just stay the same. Changes happen naturally, in your body, your energy, and yes, in the bedroom. But here's the thing, a lot of these changes can be slowed down, improved, or even reversed if you know the right moves. That's what we're about today. I want you to imagine this. John is 56, married for 30 years, and lately, he's been feeling less confident. His energy is low, and he's noticed he's not as responsive as he used to be. But he doesn't talk about it, not with his doctor, not with his wife. He just brushes it off as getting older. Sound familiar? Maybe that's you, or someone you know. What John doesn't realize is that some simple, everyday habits, almost invisible mistakes, are silently holding him back. These habits aren't just in his bedroom but ripple out, affecting his mood, his health, and his connection with his partner. Many men feel isolated because they think these issues are a sign they're failing somehow, or it's just normal aging with no solution. That's not true. And that's why this video is so important. To break that silence and give you practical, real steps that really work. Now, let me be clear, this isn't about pushing expensive treatments or quick fixes that don't last. It's about the basics, the foundation, things you might be missing right now that, once corrected, can make a huge difference. Over the next few minutes, I'll walk you through the 5 most common bedroom mistakes men over 50 make, often without even knowing it, that can silently chip away at your health and confidence. We'll talk about sleep, hydration, muscle strength, mindset, and emotional connection. I want you to feel empowered, not judged. And if you're still watching and finding these insights valuable, please comment number 1 below to let me know you're here. And if you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any videos. Your support helps us keep creating content that informs and inspires. Because here's the truth, your best years aren't behind you. In fact, with the right knowledge, they could be your most vibrant and fulfilling years yet, starting right now. So, if you're ready to break free from these silent struggles, keep watching. Let's uncover these mistakes and learn how to fix them, together. Alright, let's get into the first big mistake many men over 50 make, neglecting quality sleep. You might think, I'm just tired because I'm getting older, but the truth goes way beyond that. Sleep isn't just rest. It's the foundation for your body's repair system, hormone balance, and energy levels. And hormones? They're the silent drivers of your bedroom health. Testosterone, in particular, is essential for libido, muscle strength, and overall vitality. But here's the kicker, poor sleep can slash your testosterone levels by up to 30%. Imagine waking up day after day feeling drained and disconnected, with no real energy for intimacy. That's exactly what happens when sleep gets compromised. But it's not just the number of hours you sleep, it's the quality. Deep, restorative sleep is when your body repairs tissues, regulates hormones, and refreshes your mind. Without this, you might notice reduced sex drive, erectile challenges, and even mood swings that make intimacy harder. Now, if you're thinking, I can't control my sleep, hear me out. There are practical, science-backed habits that can improve your sleep quality dramatically. Stick to a regular sleep schedule. Going to bed and waking up at the same time every day sets your internal clock right. Limit blue light before bed. Screens emit blue light that tricks your brain into thinking it's daytime, messing with your sleep cycle. Try shutting down devices at least 60 minutes before bed. Create a restful environment. A cool, dark, and quiet room makes all the difference. Consider blackout curtains or white noise machines. Avoid heavy meals and alcohol close to bedtime. These disrupt digestion and sleep cycles. Try relaxation techniques, gentle stretches, meditation, or breathing exercises can calm your mind. I want you to think about how your current sleep habits might be holding you back. Are you rushing to bed late after screen time? Do you wake up multiple times at night? These are signs your body isn't getting the rest it needs. Let me share a quick story. Dave, 62, struggled with low libido and fatigue. After improving his sleep hygiene by cutting screen time and establishing a calming bedtime routine, his energy skyrocketed and intimacy improved. He called it a game changer. So if you're still watching and finding this valuable, comment number 2 below to let me know you're here. And if you haven't subscribed yet, please do and turn on the bell so you don't miss future videos with practical tips like this. Remember, better sleep equals better bedroom health, and better quality of life. Now, let's tackle mistake number 2 that's silently harming many older men: ignoring your pelvic floor muscles. You might be wondering, pelvic floor? Isn't that just for women? Not at all. Men have pelvic floor muscles too, and they play a huge role in sexual function, controlling erections, ejaculation, and even urinary health. As men age, these muscles can weaken, often without noticeable symptoms at first. But over time, weak pelvic floors can lead to problems like erectile dysfunction, premature ejaculation, and reduced control during intimacy. Even urinary leakage or frequent bathroom trips at night can trace back to these muscles. Here's the key: pelvic floor strength is trainable, and it's easier than you might think. The most famous exercise is the Kegel, but many men don't do them right, or don't do them at all. Let me guide you through a simple version: identify the right muscles. The easiest way is to try stopping urination midstream. The muscles you use there are your pelvic floor muscles. Don't make a habit of stopping your pee regularly, but this is a good way to locate them. Basic Kegel: tighten those muscles, hold for 3 to 5 seconds, then relax for 5 seconds. Aim for 10 reps, 3 times a day. Progress gradually, increase hold time as you get stronger, up to 10 seconds. Why is this so important? Because a strong pelvic floor means better blood flow to the penis, firmer erections, and more control during sex. Studies show men who regularly do pelvic floor exercises report improved sexual performance and satisfaction. It also reduces the risk of prostate problems and urinary incontinence. If you're thinking, I don't feel any issues yet, do I still need to do this? Absolutely. Like any muscle, prevention is easier than recovery. Strengthening these muscles now can save you from bigger problems down the line. And here's a quick tip: consistency is everything. It might feel awkward at first, but make it part of your daily routine, like brushing your teeth. If you're still watching and finding these insights valuable, please comment number 2 below to let me know you're here. And if you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any videos. Your support helps us continue creating good content to inform and inspire you. Now, let's move forward to mistake number 3 and uncover another silent saboteur of your bedroom health. Now, let's move on to mistake number 3 that often goes unnoticed but quietly wreaks havoc on older men's bedroom life: ignoring chronic stress. Stress isn't just something you feel mentally, it has real physical effects, especially when it comes to sexual health. When your body is under constant stress, it releases hormones like cortisol and adrenaline. These hormones prepare your body to deal with immediate danger, but when stress sticks around day after day, these hormones throw your body, and your libido, out of balance. Here's what happens: chronic stress causes blood vessels to constrict, reducing blood flow to crucial areas, including the penis. That's a major reason why stress is linked to erectile dysfunction, ED. Plus, stress can interfere with testosterone production, your key hormone for maintaining libido, muscle strength, and energy. But it doesn't stop there. Stress can also mess with your brain's ability to trigger sexual arousal. You might feel tired, distracted, or just off when it comes to intimacy. The good news? There are simple, effective ways to manage stress and protect your bedroom performance: mindful breathing. Spend just a few minutes each day focusing on slow, deep breaths. This helps activate your parasympathetic nervous system, the rest and digest mode, and calms the stress response. Regular exercise, physical activity boosts mood-enhancing endorphins, lowers cortisol, and improves blood flow. Quality sleep, aim for 7 to 8 hours. Sleep deprivation spikes stress hormones and lowers testosterone. Meditation or guided relaxation, even 10 minutes a day can make a big difference. Prioritize time with loved ones. Positive social connections reduce stress and improve overall well-being. Ignoring chronic stress doesn't just harm your bedroom life, it affects your heart, brain, and immune system too. If you're still watching and finding these insights valuable, please comment number 2 below to let me know you're here. And if you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any videos. Your support helps us continue creating good content to inform and inspire you. Coming up next, we'll reveal mistake number 4, the surprising role of certain medications that many older men don't realize are damaging their bedroom health. Stay tuned. Let's dive into mistake number 4, which surprises many men, overlooking the impact of common medications on sexual health. As men age, it's normal to be prescribed medications for blood pressure, cholesterol, depression, or prostate health. But here's the catch, many of these drugs have side effects that silently sabotage your bedroom performance. The problem is, most men don't connect these medications to their sexual issues and just accept a lower quality of life. For example, beta blockers, widely prescribed for high blood pressure, can reduce blood flow and lower libido. Some antidepressants, especially SSRIs, can dampen sexual desire and make it harder to reach orgasm. Even common diuretics and medications for enlarged prostate may contribute to erectile dysfunction or decreased sensation. The key is awareness. Don't just accept side effects as inevitable. Talk to your doctor about any sexual health issues you're experiencing and ask if your medications might be contributing. Sometimes, switching to alternative drugs or adjusting dosages can make a huge difference. Besides medication, supplements and over-the-counter remedies you take without consulting your doctor can also affect sexual function. Natural doesn't always mean safe when combined with prescription drugs. In the meantime, you can support your sexual health by staying hydrated, which improves circulation, eating nutrient-rich foods to support hormone balance, avoiding alcohol and tobacco, which worsen medication side effects and blood flow, maintaining regular exercise to boost cardiovascular health. Remember, being proactive with your health and openly communicating with your healthcare provider can help you avoid this silent bedroom saboteur. If you're still watching and finding this information useful, please comment number 2 below to let me know you're here. And if you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any videos. Your support helps us continue creating good content to inform and inspire you. Coming up next, the 5th and final bedroom mistake older men make, a hidden lifestyle habit that most never realize is holding them back. Don't go anywhere. Now, for the final and perhaps most overlooked mistake, ignoring the power of emotional connection and communication in the bedroom. Many older men believe that physical performance is all that matters when it comes to intimacy. But here's the truth, sex is not just a physical act, it's deeply emotional. And without that emotional connection, bedroom satisfaction can silently suffer, even if everything else seems fine. Stress, past disappointments, or simply getting out of the habit of opening up about desires and fears can create a wall between partners. This wall reduces intimacy, which affects arousal, satisfaction, and even performance. Older men often feel pressure to perform and hide vulnerability, but this only adds to anxiety and disconnect. Being honest about your feelings and encouraging open conversations can rebuild intimacy that energizes both partners. Here are some simple but powerful ways to improve emotional connection and communication. Make time for non-sexual intimacy, holding hands, cuddling, or just talking without distractions. Share your thoughts and listen actively. Even small conversations about feelings and desires make a big difference. Express appreciation regularly. Gratitude strengthens bonds and reduces resentment. Consider couples counseling or therapy if emotional barriers feel too hard to break alone. Practice mindfulness together. Being present in the moment can enhance emotional and physical connection. By nurturing emotional intimacy, you not only improve your sex life but also deepen the overall relationship, a win-win that's vital for lasting satisfaction. If you're still watching and finding these insights valuable, please comment number 2 below to let me know you're here. And if you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any videos. Your support helps us continue creating good content to inform and inspire you. Up next, we'll wrap everything up with a powerful summary and practical next steps you can start today to avoid these bedroom mistakes and reclaim your confidence. Thank you so much for staying with me through this deep dive into the 5 bedroom mistakes silently harming older men. It's not always easy to face these truths, but recognizing them is the first step to turning things around and reclaiming a healthy, joyful intimate life. Let's quickly recap the 5 mistakes. Neglecting pelvic floor health and muscle tone, relying too heavily on medications without lifestyle changes, skipping essential foreplay and intimacy-building activities, ignoring the impact of diet, alcohol, and smoking on bedroom performance, overlooking the vital role of emotional connection and open communication. Each of these mistakes chips away at your confidence, pleasure, and connection, often without you even realizing it. But here's the good news, these are fixable. With simple, consistent changes, you can bring back energy, desire, and satisfaction, no matter your age. Start small but be consistent. Try incorporating the 90-second pelvic floor exercise we discussed earlier daily. Pay attention to your diet and lifestyle choices. Communicate openly with your partner. Prioritize intimacy beyond just the physical act. These steps create a powerful ripple effect for your bedroom health and your overall well-being. Remember, the goal isn't perfect. It's progress. It's about feeling good in your own skin and rediscovering connection and pleasure on your terms. If you found this video helpful, please take a moment to leave a comment below. Share one thing you learned today and how you plan to use it in your life. Your thoughts are important to us, so don't hesitate to share them. Reading your comments gives us great motivation and encouragement. If you enjoyed this video and want to support the channel, please like, subscribe, and share. Your support helps us continue creating good content to inform and inspire you. Thanks for watching, and we look forward to seeing you in the next video.